Friends, welcome. It is the top of the hour, and as promised, I am going to get us started. I'm Karrie DeVore. I'm your local sales director in Arizona. I do cover multiple states from Arizona and keep us connected with our local carrier resources. I'm just one of the resources available to you here at Fidelis. To make it easier for you to not be distracted, I'm going to turn off my camera, but I wanted you to know I'm here, I'm live, and I'm not alone. I have a number of friends who have joined us today to help us as we cover the topic of growing your Medicare business using strategic marketing. I'm glad you're here. We're all glad you're here. And speaking of all of us, I wanted to introduce you to our entire Fidelis team. This is our sales team. We actually have a full support team here at Fidelis to help you with all of your needs. But today, as we talk about strategic marketing, I'm especially wanting to introduce you to our full sales director team who is on the line. I'd like to start by letting you know that Adam Brissalara, our co-founder, has joined us today. Adam, if you'd like to say hi. If not, that's okay. I might have caught you.
Absolutely. Love to say hi to everyone. Welcome, guys. Great to have you on here. Look forward to hearing some exciting information with you and upcoming rollouts as well. So lots of good things to come. Thanks for attending today.
All right. Thank you, Adam. We also have our Senior Director of Sales, Bernadette Russo, online with us. Bernadette, would you like to say hello?
Good morning, everyone. I'm so glad to see so many folks on the call. Looking forward to helping you get some marketing tips and tricks for this AEP. So welcome to all.
Thank you, Bernadette. And I noticed that we also have our star sales director from New Mexico on the line with us. Brad Willard, are you here and would you like to say hello? I might have caught him off guard. We will move forward. We do have also Marisa and Nick on our sales director team who I believe may be joining the call. I wanted to take a moment to introduce this team because we are all here to support you. Also, our friends who have said hello, they will be manning the chat. So as I mentioned, if you have questions as we're walking through, our friends here on the line will be glad to chime in. Also on this call, we have our Director of Operations, Mitch Anderson, who's joined us. Mitch is a great resource to us, particularly on the topic of compliance. And also not pictured, but on this call is Mackenzie Sharp. She, again, helps with the compliance side to make sure that if we have questions or things that need to go through CMS or we need additional research on, we have a whole team to help and support you. It's just one of the value-added resources of being with Fidelis. And we're so glad you've joined us here today. I'm going to go ahead and get started. So on the topic of strategic marketing, that seems a little overwhelming when you think about it. So I need to tell you that my promise to keep this under an hour, just barely under an hour, I'm going to honor that, which means that I'm not going to be able to go as deeply as I would like into this topic, but I am going to give you some tools to get you started. We're going to talk about making the most of the available resources that you have and some tips to maximize your opportunities. I am going to touch on some special rules for marketing, and I'm going to give you kind of a point you in a direction of some additional resources to help you because I cannot cover all of the CMS regulations on this call. This would definitely not be an hour-long call. So I hope you understand. I am going to give you some final tips to help you. Remember, this is an interactive session, meaning that you can type questions into chat all the way through. So if there's anything that we can help you with, we may not have the answer at this moment, but we do have a commitment to follow up with everyone regarding the answers to any questions that are asked today. As a bonus, I do have some resources that at the end of today's session, I'm going to make available as a download from the Zoom. And I'm even going to have our brilliant marketing team help you by sending this out just to make sure that you have all of the available resources to help support you. Now, when we talk about strategic marketing, what I'm really talking about is not so much just the ways that you can market your business, but really it's about tying in the technology that you have available to you, the marketing strategies that you choose to use, your available sales opportunity, and taking advantage of the support that's available to you and combining that to get the most mileage out of all of the marketing efforts that you have. That's what strategic marketing is all about. And that's what today's session is really about. So I'm hoping that today there's something that sparks a thought, an interest, or helps you grow your business plan to help you grow your Medicare business. So with that, let's get started. I have to tell you, for those of you who know a lot about my background, I've actually worked in the marketing field for a long time before coming to Medicare side. And I've always been asked, with so many different ways to market, which way is the very best? Well, I have to tell you, first of all, I'm going to point out that I've underlined the words the best as a reminder that we're careful not to use superlatives in our world, particularly because CMS says no. So I just wanted to point that out. But when we talk about strategic marketing, it's really about aligning your plan, the market opportunity, your resources, and also your commitment to follow through into your marketing efforts. So the best plan is the marketing strategy that honors your commitment, the opportunity, and your actual business plan. So what I mean by that, a great example is you could buy a tremendous number of leads. You'd spend tens of thousands of dollars to purchase ready to buy leads, and that's available to you. But if you don't ever call on those leads, they're wasted money. You could also put up a great billboard. It could be the most beautiful billboard in the world. But if you put it out in the middle of a desert where no one's going to see it, it's a wasted effort. But if you take those same strategies and you apply it in a way that you're committed to follow through and that it's high visibility, and then you also partner it with your referral strategies and some other things I'm going to share with you today, you are actually going to find that your marketing efforts will not only be successful, but they will multiply forward. And that's really the key to strategic marketing. So whether you are looking at doing paid strategies like purchasing leads or any number of ways to advertise your business, from pay-per-click and behavioral targeting online to signage and newspaper, whatever it is that you choose to do, all of those paid strategies or any kind of opportunity to do sponsorships or branding, those are fantastic, but they are more fantastic when you use your available tools to make them grow into not only a sticky factor where they're enrolling with you, but also where they become a natural referral source for you as you move forward. And the nice thing that I have to share with you today is that whether you're choosing a grassroots model where you're reaching out and developing strong referral sources, or focusing on those things that you invest time and effort more so than money, all of those things that work together, Fidelis has support systems in place to help guide you step by step. One of those great resources that I'm going to walk you through in a moment is available on the Fidelis Agents portal. And it is step-by-step videos that will literally walk you through a number of these strategies. I am going to mention that if you're not using the tools that are at your disposal as a Fidelis agent, I want to encourage you to do that. One of the great tools is your Pearl. How many of you on this call are currently using your personal URL that you have available to you through Medicare Center? Let me know in the chat. Are you currently using your Pearl? You didn't know I was going to make you work, right? Let me know. Okay. whatever it is that you choose to do on your strategies, oh, I like to see that. I want you to know that the key is really creating a synergy between using the tools available to you, really looking at where the opportunities are, and the opportunities that you have to receive additional resources and support. And the best key that I can give you is your Fidelis Sales Director is here to help you. All of us here on this call and those who couldn't make it to today's call are here to support you and help you grow your book of business. That is our primary goal. So don't be afraid to use us as your resource. I mentioned MedicareCenter.com, and it looks like a few of you are actually actively using it. Not everyone, but I wanted to remind you, if you haven't already registered to use Medicare Center, it is a fabulous tool. And the first step is you need to make sure that you have at least one valid contract through Fidelis to get access to this. But once you are contracted through Fidelis as your FMO, you do have access to Medicare Center and the next few tools that I'm going to show you. If you haven't used it in a while or you've never used it, I'm going to encourage you to ask your sales director for a guided tour. Now, first of all, when you do register through the Medicare Center, you're going to find that there is online learning, but we're happy to do a personal guided tour as well. There are too many great things that you can do in Medicare Center, such as have an electronic scope of appointment that's carrier neutral, that you can send out well in advance of your appointment to make sure that you're managing your time well. It also gives you access to that Pearl that I'm going to show you here in a moment. And of course, the lead center where you can purchase ready to contact and permission to contact leads as you have availability. And as I mentioned, the online training. Lead Center is just as you would expect. It's an opportunity for you to purchase leads, whether they are for life or for health, anywhere in the nation that there is opportunity. This is something that is updated in real time, so you are able to purchase as many or as few leads as you wish. The nice thing about using the Lead Center is any Medicare beneficiary leads that you purchase through Lead Center automatically go into your contacts in Medicare Center. So they're easy to interact with, and it's a great way to help you continue to grow your Medicare book of business. You can purchase the leads when and where you need them. And it's easy to initiate an electronic scope of appointment because, again, those leads are going directly into your Medicare Center contacts. My favorite topic, of course, is using your Pearl. If you haven't used it before, or if this looks brand new to you, I want to share with you that this is an amazing no-cost enrollment platform that every Fidelis agent or agency partner has access to. Again, it's no cost to you. And if you do not already have access to it, reach out to your Fidelis Sales Director. We will be glad to help you gain access. So with this, I want you to know that your enrollment site or your Pearl is something that you can share as part of your email signature. You can send it to any of your clients as you are communicating with your 30, 60, 90-day follow-ups, or even as you're setting appointments, just to remind them that you have an easy access website that allows them to basically shop in a sandbox of the plans that you're ready to sell with. And you'll notice that everywhere on your Pearl, it refers them back to you, including using your provided recorded line, so that you're fully compliant. This is a CMS compliant enrollment platform. And as I mentioned, whether someone is just shopping in general, or if they are ready to make an enrollment, they can do that compliantly. And at every point, it turns them back to you. It's an easy way for you and your clients to maximize your time and enroll more people. Next resource that I want to bring to your attention is our agent portal. If you haven't been in there recently, may I just recommend that you take a few moments. I can't go through everything that's housed in the agent portal for you today, but I am going to touch on just a couple of them. And those two that I'm going to touch on today are the Marketing Hub and the Fidelis University. As I mentioned before, in the Fidelis University, that's actually where you're going to find all of that step-by-step guidance to grassroots marketing and marketing in general, as well as building a great business plan to help you maximize your marketing efforts. And of course, it's an easy way to connect with your sales directors as well. If you do not have access to the Fidelis Agents portal, please reach out to us today. In fact, don't even wait. If you need access to the portal, will you do me a favor and just type that in the chat? Say, need portal. If you tell me that you need the portal, we will make sure that one of our sales directors follows up with you immediately after today's webinar to ensure that you get the access that you need to the tools to get you growing your Medicare business this year and starting today. Perfect. Thank you, Sandra. We'll make sure that we follow up with you immediately after this webinar. All right, same thing to you. I'm so excited to see that. All right, I mentioned the second thing I wanted to show you is our Marketing Hub. At Fidelis, we actually have an internal marketing team that is phenomenal. They offer us not only support in everything that you do, they can, I'll show you a little bit more about what they can do to support you beyond collateral, but we know that many of you on this call represent multiple carriers, and sometimes it's nice to have carrier neutral collateral that's already CMS approved. And I want to tell you that at Fidelis, we've invested very heavily in making sure that these tools are not only available to you, professionally produced and fully compliant, but they're also easy for you to access and customize. So this is just an example of some of the things that are available within our Marketing Hub. Again, this is accessible through our Fidelis Agents portal. So as soon as you have any contracts under the Fidelis umbrella or any of our agency partners, you do get access to all of these things. There is a step-by-step guide to walk you through how to customize each of these pieces. But if you ever need help, you can call us directly. All of your sales directors are great at helping you customize these, and we'd be happy to help. Perfect. Okay. Another thing that you may not have realized that we can help you with is when you're hosting events, whether it's with for clients, if you're doing a large meeting or doing any kind of a recruiting event, we actually can help you. We can help you create emails to help you get that recruiting out. We can help you with RSVPs and email support. Sometimes we can also help with the graphic design for the emails, mailers. I will tell you, we might be a little bit limited at this moment, but with enough advance notice, we can usually help and support those too. This is just one of those value adds where Fidelis is really your partner to help you build and move forward with your Medicare business. And we're really happy to do it. This is just one way we do it. Another thing I want to just point out is there are a lot of available resources. I will not be able to cover everything here, but I'm hoping that I cover enough of them that you know exactly where you can go to plug into even more help. Your sales director really is the key to that. Okay. And hold on just a moment. I see that my friend Rusty is not getting any audio. Russ, oh, you're not going to be able to hear me. If someone in the chat can explain to Rusty how to go in through the settings and change his audio settings, that would be fantastic and appreciated. Thank you. All right. So I am going to move forward. So obviously, I think our best resources are always those word of mouth referral clients, because you're getting an endorsement from someone they already trust, I just want to remind you from a compliance standpoint to make sure that you're making it easy for those existing clients to give that word of mouth endorsement. Remember, they cannot give you. Marina, could you please mute? Thank you. Marina, could you please mute?
Really? You didn't tell me.
Hey, Marina. Hi, can you just mute for us, please?
Oh my God. You should have.
Oh, there we go. All right. Sorry about that, friends. So when it comes to the existing clients, please make sure that you're using your Pearl, handing out extra business cards, making it easy for their referrals to contact you so you stay CMS compliant. If you have any questions about that, just reach out to us. We'll be glad to walk you through. Another thing that you can do to ensure that you're not only getting the maximum value from being co-branded with our carriers, but also that you stay compliant, is to use some of the carrier resources. All of our carrier friends have some kind of CMS approved collateral that they encourage you to use. So once you're ready to sell, each carrier has their own process. I'm going to show you a couple of them just to get you started, and then I'm going to share some resources from one of our carrier friends today. But I encourage you to use those. And then the other thing, and this kind of goes with the existing clients, where I would encourage you to use your Pearl and also hand out extra business cards. But I encourage you to, especially right now, so it's August 30th, this is a great time to really be tapping into your sphere of influence. And what I mean by that are, who are the people that you know, where are the places that you go, and all of the people that they know, because they can become your best referral source. Again, just expanding that word of mouth business. And then, of course, sponsored events and opportunities. I get a lot of questions about this, but where can I find these types of opportunities? I'm going to give you a couple of takeaways at the end of today's session. But in addition to that, I want to encourage you. Every one of our carrier friends has a process to help you engage with already planned events and opportunities. However, for many of them, in fact, I would say most of them, having a good, solid business plan and finding your own or creating your own opportunities is really the gold star of how to get those support, or the best level of support from our carrier friends. You can't just go with a blind idea. If you have a really solid plan that shows what you're working towards, what you're expecting from it, you will get a much better response and a much better support model, whether that's about supplying you with co-branded materials, or just some additional resources, or just help in filing the event in general. These are things that are available to you. And my best advice is, of course, coordinate through your sales director at Fidelis, because we not only have great relationships with the carriers in your area, but we can help you, guide you to how to build and present your plan so that you are likely to get additional resources or support. So take advantage of everything that's available. And I wouldn't be doing a great job if I didn't tell you that there are some integrity exclusive opportunities that are available to you as a Fidelis agent. And we have some exciting things that we'll be sharing too. So make sure that you're tapping into all of the available opportunities that, of course, honor your plan and your opportunity. So ask us, because those opportunities are here. There are a lot of them, and I don't want you to miss them. So with that, let's move forward. I talked about carrier approved collateral. These are just a few examples. My friends at United, Humana, and Devoted said that they would love for me to feature their sites, just to remind you that they have resources. I also need to tell you, because Fidelis is licensed in all 50 states, and we support agents wherever you have opportunity. And we do work with carriers across the board. In fact, we have access to, I want to say, it's definitely over 150 carrier contracts that we have connections with in some regard. So if there's a place that you see that there is opportunity and you're not sure how to get started, please reach out to us. I am going to mention that on the carrier approved sites, each of them has a slightly different way that they allow you to access information. And I know sometimes that can be overwhelming. We are all well versed in helping you navigate each of these sites. But I want to point out for those of you who are ready to sell with United Healthcare, of course, through UHC Jarvis, you do have access to a full agent toolkit, which will give you access not only to the co-branded flyers and mailers and postcards and those types of things, but also signage for your events. And what I found that a lot of people aren't using or maybe didn't realize it was available is the ads. You have pre-approved ads. I'll show you a little bit more of what that looks like, but it's a great resource within the UHC toolkit. Humana has done an exceptional job of tying in available collateral and strategy guides in their marketing resource center. And today they've actually given me permission to share a couple of their resources as a download. So at the end of today's session, I will be doing that. You will find that there is a whole host of information available between UHC and Humana that can take you from just courses to walk you through step-by-step different strategies, and also guides to different grassroots marketing strategies, as well as access to tools for paid strategies. I also want to point out that our friends at Devoted have put together, of course, all of those things and a little bit more. They've also gone a little bit more robust on their social media side, and they've asked me to help remind you that that's now available to you. So no matter what carrier you're working with, and of course, Cigna has similar things, all of our carrier partners have some level of support, and we're here to guide you as your Fidelis Sales Director. So just reach out to us if you need any help at all. Of course, I'm going to remind you that using carrier-specific provided collateral is an easy way to make sure that everything that you're putting out there has already passed through CMS compliance. So it's a great way to do it. I mentioned the United Healthcare, which they do have some social media ads. That's an easy thing to access from their site. When you go into the toolkit, if you just type in for the keyword social media, you'll have a whole list of the available posts that, as a ready to sell agent, you can use those posts on your social media. There is a little bit of additional guidance as to the proper way to do that. We're glad to help you with that. They also do have pre-approved ads. So if you're running newspaper ads and you would like to be co-branded with United Healthcare, they've made it very easy. Of course, you know, if you've ever used the United Healthcare collateral, it will automatically allow the customization with your name, your phone numbers, addresses, and your website, those types of information. But everything else is locked so that it stays a CMS approved piece of collateral. And with that, you are welcome to use it to advertise your business and encouraged to do so. I mentioned Devoted has expanded their social media posts. They've also done a great job of including a social media guide. How many of you on this call have been using social media strategies so far to help build your business? Let me know in the chat. Have you been using social media strategies? This is an easy access guide. No? Okay. Is that something that you would like to do more of? Let us know. Okay. Another one that I just want to point out is Humana. Now, I've had some feedback about this because Humana has a very robust social media library that you can easily post, but they do require you to go through a required training to be able to access it. If you need help going through this training or accessing it, just let us know. We're happy to help you. Once you have a certificate awarded, not only will you have access to the best marketing practices and tips for social media, but you'll also be able to access great ads that are pre-created for social media, and you'll be able to simply post them right from their tools. Another tool that I want to make available to you, because as a Fidelis agent, you have access to a paid service at a discounted rate. For those of you who are thinking of social media and feeling overwhelmed, I hear you. And there is a service that's available that can do turnkey social media marketing, because we know how important it is to have that connection out there and an easy referral source. So there is a company that we work with pretty regularly for many of our agents. It's called Snoozy, and they do have a discounted paid service that's available month to month for Fidelis agents. If you're interested in that, I've included the URL to where you can contract with them. The nice thing about this company, Snoozy, is they are very experienced in the Medicare space. These are people who understand the CMS regulations and will keep you out of trouble as they're making posts. So that is why we do recommend them for social media marketing. They also offer custom website design, and as you can see, a very affordable package that's available to all Fidelis agents. Let us know if we can be of any help making that connection for you. And also give us some feedback. If you have used Snoozy in the past or you choose to use Snoozy now, let us know how your experience is. We're always looking. We've heard really good feedback from them, but we always want to make sure that we keep the best of the best with our agents, because we already know you are the best of the best. All right, I know I'm halfway through our session, and I feel like I haven't even touched on this super important thing, which is developing a great business plan. And, you know, a little tip that I can give you is start building your plan now. Start with your known opportunities. I mentioned before, this is a great time to start just planting the seed with your existing sphere of influence. Make sure that you're planning your time well. And so the best way to do that is, if you have known opportunities that you're going to be spending your time in a certain area, let's really maximize your time and see what other opportunities and referral sources you can tap into. It's something that, if you've never done it before, where you planted some seeds for referral sources and you'd like some guidance, every one of our Fidelis Sales Directors is experienced in this area, and we would be glad to connect with you and help guide you through this process. There's also on-demand training that's available on our Fidelis Agents portal. All right, now I am not going to go through all of this. I think I've actually touched on a lot of this already. If you want to take a screenshot, you're welcome to, but for those of you who do not regularly plan, sometimes it's easy to ask yourself questions and it actually will create a plan. So make sure that you're thinking through your available time and commitment, particularly as we're coming up to AEP. It's going to fly by fast. It's only 54 days and there's a lot of opportunity. So no matter where you are, there is a great opportunity, because every single Medicare eligible beneficiary in your area has a decision to make, because not making a decision is still a decision, right? So with that in mind, if you find that as you're planning out your AEP schedule and your strategic marketing plans, if you're finding gaps, let's look at how we can create your own opportunities. And that's something that we can help you with if you're not sure. We want to make sure that when we are reaching out and trying to create referral resources or trying to create partnerships, the best tip I can give you is make sure before you ever step in a door that you are very clear on the value you bring to that company. So for example, if you're going out to do provider outreach, and you talk about how you can become a trusted resource for them. You can help their patients who maybe lack coverage or are confused and have questions. You might be someone who is ready to sell with multiple carriers, multiple top carriers in the area, and that could be an added asset where you can do training for the practice staff. Just as an example, there are lots of different types of referral resources out there and partnerships. If you're not sure how to address it, just reach out to us. We'll be glad to help you, but make sure you're clear on your value statement before you go in, because you're there to help. And just as a byproduct, you'll continue to help build your own Medicare business. I cannot emphasize this enough. We're August 30th. Make sure that if you haven't already started ordering your enrollment kits, I know that's opened up for a number of our carriers. Let's start looking at that now. Today is a great day after this call to do that. But also there may be other supplies that would be helpful for you, whether you're out in the field or you're making calls. Remember, by having the right supplies, being well prepared, you will save time, you will save money, because you will not have to go back and double back on your appointment. You'll be able to help more people that way. And speaking of helping more people, have you set your own enrollment target for this AEP? Let me know in the chat. All right. So when it comes to help with the planning tools, there's a lot of things that are available to help you because you are a Fidelis agent or agency partner. And I know I've said it repeatedly, but your Fidelis Sales Director or your direct upline, if you're with one of our agency partners, that is a great first step. If you need help with your business plan, anything like that, that is where you want to go. But we can often help you with other questions too. Another thing that I want to point out is some of the on-demand resources. I've referenced the Fidelis University. I wanted to give you a preview. If you haven't actually gone in and watched any of these videos, not only are there downloadable PowerPoints where you can do some self-paced education, but we have the privilege of having videos that, for the most part, I believe our fearless leader, Adam Brisolara, has taken the time to personally record all of these training sessions, and they are available on demand through Fidelis University. Again, that's within the Fidelis Agents portal. And it will walk you through step by step, whether it's about utilizing carrier resources or Fidelis resources, or even going back to creating a business plan and preparing for a strong marketing strategy. We have step-by-step guides that just get you pointed in the right direction. Another thing that I want to point out is in these videos, there is a step-by-step guide for reaching out and creating referral opportunities with food pantries, dental marketing, and more. So if you haven't ever accessed those, you might want to check that out. It might be on your list for today. Another thing is, for those of you who are interested, there is a downloadable template for an agent business plan. And it will just help you shape how you might want to set up your marketing and how you're planning your days, particularly as we're leading up to AEP. But we're actually in a year-round business, and we're all here to support you. And then another thing that I'm finding that a lot of agents and agency partners may not have known is available in the Fidelis Agents portal is instructions to help you get through any available co-op requests. But I want to point out that you also have carrier friends. In every single area that we serve, we have carrier reps and area managers, and they are always happy to help. If you've not connected with your local carrier friends, please reach out to your Fidelis Sales Director. We would be happy to help make that connection for you. Carriers, again, have a lot of resources available, from training to marketing to anything you need to support you as you're building your Medicare business. I feel like I'm showing a lot of favoritism to a few of our preferred carrier resources, but may I tell you, we work with so many carriers. Medicare isn't the only space we serve at Fidelis, but it is our primary. And so we are definitely here to help you as you're building your book of business and helping so many this Medicare AEP season. So speaking of opportunities and speaking of Medicare, I just want to point out, before you start any marketing, I really want you to think long and hard about what your marketing strategy is and how it lines up with the different enrollment periods. So the annual enrollment period, of course, is October 15th to December 7th. And it does allow us to do more active marketing than other seasons. As we know, OEP and special election periods, I have a little caution check mark there because you have to be very careful in doing any kind of marketing in those areas. As a matter of fact, OEP, that January 1st to March 31st, is often referred to as the non-marketable opportunity. And then, of course, the golden enrollment period, which is the initial enrollment period for those who are aging into Medicare for the first time. That can happen at any time of year. There is CMS guidance for each of these enrollment periods. If you're not familiar with them, please reach out. We would be glad to help guide you as to how to stay compliant as you're establishing your marketing plans. And speaking of special rules for marketing, I, of course, need to let you know that there are lots of resources available to you. I cannot possibly cover all of the rules. I see that I'm a talker and we're down to our final 18 minutes of this webinar. So this is a really important resource. The cms.gov site, of course, will give you access to all of the rules. A lot of things that we, of course, are required to know to make sure that we stay compliant as we're helping people with their Medicare decisions. Your direct upline, if you're working under an agency, is also a great resource. And your Fidelis Sales Director, Compliance, or Marketing Officer, we all have connections to help you get answers that you need to make sure that you stay compliant. And of course, your preferred carriers have resources as well, and they are a great resource for you to tap into to make sure you stay compliant. I'm only going to touch on a few because there are lots and lots of CMS rules, and because I don't want to keep you here for 3 days to walk through all of them, I'm just going to point out there have been some updates to what classifies as marketing materials from the CMS perspective. So remember, any collateral that mentions a specific benefit of any kind, so whether that's a dental, vision, hearing, healthy food benefit, anything, that is considered a marketing material, and there are rules surrounding that. And while I can't go into all of them on today's session, I can give you access to the resources. And the number one thing that I'm going to tell you is your resources, of course, your sales director, and of course, your carrier representatives or CMS. Another thing I just want to highlight, because many agents, of course, have made practice of promoting themselves with Medicare as part of their name or Medicare as part of their messaging. And an easy way to make sure that you stay compliant is to make sure that every piece of collateral with that on it, including your business cards, it highlights the fact that you are a non-government agency. You want to be careful. That's been something that CMS has really been highlighting a lot this year. So we want to make sure we do our part with the right disclaimers on all of our materials. You will notice all of the Fidelis materials in the Marketing Hub already have a preemptive, a non-government agency clause on them. So again, making sure that you're staying compliant. Another thing that many agents do to help build their business is to host events. The rules are a little bit different for educational events versus sales marketing events. Actually, not a little bit, a lot of bit different. But since we're talking a lot about creating strategic plans, I want to encourage you that if you have a venue site for these events and you're doing a mix of educational and sales and marketing events, please make sure that you are keeping a minimum of a 12-hour window between those educational and sales and marketing events. That is a big update for this year. Before, you could have done them back to back, and starting this year, you cannot. So if you have any questions about that, reach out. Another thing is make sure that if you have filed your event as a formal event versus an informal event, that you are honoring the requirements for that. So of course, with a formal event, you're going to have a checklist of things that you must cover in a group presentation. In an informal, it's more of a resource table type of situation. So make sure that you're filing your events properly. And again, we're here to help you with that. Scope of appointment was a really big change for this year. Effective October 1st, there is a requirement that we have a 48-hour minimum window between the scope of appointment being signed and the appointment taking place. There are a couple of exceptions to that I'm just going to highlight, and there's also a way that we can maximize our time and get those scopes of appointments out early. And I'm going to encourage you to do that. Using MedicareCenter.com, there are the electronic scopes of appointment that you can start sending out now to the people that you know you're going to be helping this AEP, because scope of appointment is good for 12 months, up to 12 months until it's used. You could actually start sending those out now and getting them signed so that you are ready to go with your appointments. I highly encourage you to start working on that now, so your 54 days are well spent during AEP. Another thing to remember is if a client initiates the meeting, so let's say they walk into your place of business, you are not required to have a 48-hour window because that client has initiated that meeting. Not you reaching out to them, but them reaching to you if they are a walk into your place of business. Another exception would be if you are at the very end of an enrollment period. So if you're within the last 3 days of that enrollment period, the 48-hour window requirement is waived. You do want to make sure that you're keeping good notes. So if you are in any of those exception scenarios, make sure that you're documenting it. MedicareCenter.com is a great place to keep those notes because they will be stored for you for that 10-year window as CMS requires. And speaking of that last CMS requirement of call recording, that has not gone away, but we have made it much, much easier for you. How many of you on this call are using Medicare Center? If you haven't yet started using that, again, that's something that we can help you with. Perfect. Thank you, Veronica. All right. So I know I've given you a lot of things, but I'm going to give you just a little bit more. This is just my shameless plug for a few of the ways that we at Fidelis can help you as you're growing your book of business. We are your partners in growth. So whether that's helping you with your personalized business planning, if you are a newer agent and or even if you're a seasoned pro, but you feel like it would be helpful to have some appointment or event shadowing, let us know. There are ways that we can help you wherever you are, and we would be glad to do so. We have built the entire Fidelis model upon helping with grassroots marketing strategies and just helping create some of those lasting referral sources. So if you find that you're a little light on that, tap into the Fidelis resources. We're here to help you with that. Co-op is one of those things I'm not going to go too deeply into because, of course, that's when we have great plans that we reach out to carrier partners to see if they can help us with that. It's never a guarantee, but it's always something worth looking into. And it's a great strategy to help you grow your book of business. You have a friend here at Fidelis to help you with carrier relations. As I mentioned, we do have licensure in all 50 states, which means that we have carrier friends to help support you wherever your opportunity is. I like to think that we give you great access to leads and That can vary from market to market. So just reach out and let us know if we can help you. One big announcement that I am happy to share is that as Fidelis agents, if you let us know today, and today is pretty much the day you need to do this, if you are interested in taking advantage of an exclusive opportunity for Integrity Partners, which Fidelis, of course, is one, we can help you with, we might be able to help you with a Walmart location if that is something that fits into your business plan. Now, there are lots of other retail opportunities outside of Walmart. Walmart is one that has a little bit of a cost associated with it and lots of rules around it. But I know it's something that I do get asked about pretty regularly. So if that's something that interests you, you want to reach out today because there is a deadline to bid on all of the locations, and that scheduling is happening right now. So I'm glad you're on this call. And if that's something that interests you, this is one of those urgent things that you want to reach out to your sales directors. If you did not get our numbers, you may have noticed that at the bottom of every slide, I have our general toll-free number that you can use nationwide to reach our office. Of course, our office staff would be glad to direct you to your proper sales director. And then I will, at the end of this session, land on a slide that has all of the contact information because we are here to help you. I do want to point out that our great carrier friends and also some of our provider group friends have really done an exceptional job to help open up some opportunities with other retail locations. So if that's something that you would like to start incorporating into your AEP plans or other plans throughout the year, talk to us. We'll be glad to help. I do want to give you just a few final tips. Use pre-approved collateral. It will save you a lot of headaches and heartaches. So that's just a good practice. I also want to encourage you to layer and multiply your efforts. What I mean by that is if you can automate some things like your referral process using your Pearl, if you can create easy ways for people to interact and share their experience, your marketing efforts will go so much further. And we are well versed in helping with this strategy. Ask for help. It's something that whether you're asking for it from a carrier friend or from Fidelis, we're all here to help you. And of course, with AEP being only 54 days, it's going to go by fast. Let's make sure we have a great plan for our time because that, my friends, is the key to being able to help more people this year. We're happy to help you. Or if you have an upline in between where you're working with one of our amazing agency partners, please reach out to them. All of us are invested in helping you grow your business this year. So your next steps to grow are simply this. Reach out to your sales director so that we can help you as you're reviewing your goal and your plan. If you're not yet contracted through Fidelis, that is where we start. We want to make sure that we get you contracted with the carriers that mean the most to you. So let us know. You can send a quick email to contracting@fidelisins.com. Include your NPN number and all of your contact information, as well as which states you are licensed in and what carriers you are interested in, and we will take it from there. We will help you not only secure those contracts, but we'll also help you with any strategic help to make sure that you're maximizing your efforts to the opportunity and getting the best results that you can from those efforts. We're here to help you. So that, again, is in a nutshell what we're here for. We're here to help you so that you can help more people this year. And as promised, I am ending on the slide showing you the direct contact information for all of your local sales directors, including myself, Karrie DeVore. I'm so grateful that you took your time today to join us. Please let us know how we can help you. And I hope you have the most successful AEP yet. And I hope that you reach out to us so that we can just help you continue to grow. We appreciate your partnership, And I'll keep the line open for just the next 5 minutes for any questions you have. And thank you for your time. Thanks for attending today.